Hey everybody, and welcome back to my channel. Today we're going to talk about psychotherapy. So for many, the concept of psychotherapy is shrouded in mystery. When a new client thinks of therapy, they might imagine an old chase lounge, esoteric conversations about childhood, or an answer to the question, so what should I do? Of course, this isn't what therapy is usually like. A chase lounge may or may not be present, and psychotherapists rarely answer the question, what should I do? Instead, they help their clients develop the tools they need to forge their own path, taking action in fine lines with their own values. So we're going to basically talk about what psychotherapy is, and I'm going to help you understand what to expect and what can be a challenge. And I'm going to answer basic questions about psychotherapy, and I'm going to help you understand what to accept from the therapy involved with psychotherapy. So stay tuned. Okay, so psychotherapy is a process that many believe is shrouded in mystery, but it doesn't have to be that way. Therapists are normal people who usually chose their profession because they care about other people. They're good listeners and they want to help. So what does a therapist actually do, and how can they help? Therapists act as a neutral party who can listen and try to understand without judgment. Therapists help you learn about yourself by pointing out patterns and giving honest feedback. Therapists teach specific techniques and strategies to deal with problems. Therapists can refer you to additional resources in the community that might be helpful. Therapists provide a safe place to learn and practice social skills. Types of psychotherapy. There are many approaches to psychotherapy, all of which have their own strengths and weaknesses. Some situations call for a specific type of treatment, but sometimes it's just about preference. Here are a few of the most common approaches to psychotherapy. So there's cognitive behavioral therapy, which is a common and well-supported treatment for many types of mental illnesses. The theory is based on the idea that a person's thoughts influence their feelings, which the individual can learn to control. Then there's psychoanalysis. The traditional image of bushy bearded psychotherapist with a couch and a notebook is based on early psychoanalysts. Although this form of treatment has become less popular, it can still be found. Psychoanalysis focuses on childhood experiences and unconscious drives. Motivational interviewing, although typically used for the treatment of addictions, motivational interviewing is an intervention that can be used to help any person who wants to make any changes in their life. When it comes to addiction, motivational interviewing has some of the best support. Then there's person-centered therapy. A person-centered therapist will focus on building a strong, positive relationship with their client while providing an empathetic ear. The therapist will help their client find areas where their ideal self and actual self differ, and then encouraging change or acceptance. So there's different types of therapy. There's individual therapy where one client meets one therapist for traditional talk therapy. Then there's group therapy where clients meet in a group with a therapist leader. Clients usually share a similar problem. And then there's family and couples therapy where clients will meet as a couple or a family with a therapist. These therapists may have special training, but it is not always required. Next, we're going to talk about psychotherapy. Who can provide psychotherapy? The answer to this question varies by region, but in most places, psychotherapists may have at least a master's degrees from an approved program. After receiving a degree, the therapist must practice for several years under the guidance of a supervisor before becoming licensed. There's mental health counselors, which is what I am. The label mental health counselor is usually applied to a person who has received a master's degree from an approved university and is licensed to provide psychotherapy. Titles vary by region, and they are usually donated by acronyms such as LMHC or LPC. Then there's psychologists. The term psychologist typically refers to a person who has completed a doctoral degree in the field of psychology. They may or may not also be licensed as a psychotherapist. Psychologists also perform additional services such as psychological testing. Then there's psychiatrists, which are medical doctors who can prescribe medication for the treatment of mental illnesses. In some cases, psychiatrists also perform psychotherapy, but they generally refer their patients to other providers for their needs. Then there's social workers. In most regions, licensed social workers possess a master's degree in training to provide psychotherapy and other services. Social workers have additional training in areas such as case management and linking clients with other agencies and programs. Next, we're going to talk about some limitations with psychotherapy. Therapists should not tell you what to do or try to direct your life. Think of the proverb, give a man a fish and you feed him for a day. Teach him to fish and you feed him for life. Therapists will help you learn to solve your own problems rather than solving them for you. Some mental illness cannot be managed by psychotherapy alone. If medication is recommended, it's probably important. Benefiting from psychotherapy does require work on your part. Speaking to a therapist for an hour a week and then pushing it out of your mind probably won't do any good. Complete homework, practice your skills, and legitimately try to the recommendations you were given. Therapists cannot be your friend after starting a therapeutic relationship. Therapists generally like their clients, would love to get to know them better, and ethical rules prevent the formation of relationships outside the treatment. If it isn't you, it's just the therapist could lose their license. Therapists cannot read your mind. If you hide information or are dishonest, you're wasting your own time and money. So that was a quick upload about what psychotherapy is. It's what I do on a traditional basis. I love talking to my clients. I do have these limitations that we just talked about where I cannot get too close with them, but I do, all I do is I basically do positively reinforce behaviors that are unwanted or uncomfortable by replacing them with healthier alternative behavioral outcomes. So I hope you guys enjoyed my video. Don't forget to like, subscribe, comment, and thank you so much for listening. Have a great, blessed day. Mwah.